Why are therapists shortage hindering kids' mental health? Therapists are in short supply, which is making it difficult for children to get the help they need. The shortage of therapists is also causing parents to be more hesitant about seeking help for their children. Therapy is one of the most effective forms of treatment for mental health issues and can improve a person's quality of life. However, because it's difficult to find therapists, many people don't seek out the help they need. The shortage of therapists is not just a problem in the United States, it's an issue worldwide and has been for decades. 1. Therapists are overworked due to high demand. 2. Therapists have difficulty finding work. 3. Therapists who are able to find work are underpaid. What is the Times news story on children's mental health? The New York Times recently published an article on the mental health of children. The article discusses how children's mental health is not a priority in America and how it affects the entire country. The article discusses the importance of early intervention, especially for those who have parents who are struggling with depression or other mental illnesses. It also discusses why these things are not prioritized in America, where there is a lack of funding for research and treatment programs. The need for therapists in children's mental health care is insatiable. A recent study revealed that the number of children with mental health issues is increasing. This has led to a shortage of therapists in children's mental health care. The need for therapists in children's mental health care is insatiable. As more and more people are affected by this issue, there will be even greater demand for therapists in the future. Why is there an insatiable need for professional therapists in the field of child mental health care? The current therapist shortage in the field of child mental health care is a result of low salaries and a lack of incentives. The demand for therapists is high due to the increasing number of children with mental health issues. The need for mental health care professionals in the field has increased due to an increase in the number of children with mental health issues. The demand for therapists has risen because many children are struggling with anxiety, depression, and other disorders. In order to meet this growing need, many universities offer programs that lead to a master's degree in child and adolescent psychiatry or clinical psychology. How many professionals are working in the field of child mental health care? A therapist is a professional who provides therapy and counseling to individuals, groups, or families. They are trained to understand and work with mental health issues and provide services that help people overcome these problems. In the U.S. alone, there are more than 117,513 child therapists working in the field of child mental health care. What can be done about this nationwide shortage of child therapy professionals? America is facing a shortage of therapists and psychiatrists for children. A study showed that there are only 117,513 child therapists in the country. The demand for these professionals has been rising and the supply has not been able to keep up with it. What can be done about this nationwide shortage of child therapy professionals? This is a very complex question that requires many different solutions. Increase funding for various early childhood education and school programs to increase the number of trained professionals. This is a very difficult solution because it relies on other funding that may not be available in some areas. Increase minimum qualifications for child therapists. This might increase the supply, but it also might diminish quality. Increase the number of available scholarships. This might increase the supply, but it also could decrease the incentive for students to attend full-time programs, which would negatively affect quality.